next. Hi, I'm Nurse Kayleen, and I'm going to be doing your head to toe assessment today. Does that sound correct?
Yep.
Alright, I'm going to wash my hands, ensure privacy. Can I get your name and date of birth?
Alexia Kerwin, 01045.
Okay. Alright, that matches. And I put gloves on if necessary or needed. I'm going to ask you a few questions. Are you in any pain today?
Nope.
Are you on any medication?
Zoloft and birth control.
Okay, and do you have any history of surgeries?
I had a heart ablation.
Okay. So during this head to toe assessment, I will be inspecting, palpating, percussing, and auscultating different parts of your body to make sure there's no abnormalities.
Okay.
All right. During this assessment, is it okay if I touch you?
Mm-hmm.
Okay. And if you're uncomfortable at all during this assessment, please let me know.
Okay.
And we can stop it. I noticed your body appears erect. Your movements are voluntary. I don't see any movements that are involuntary. You are well groomed. Your body or your face, your mood seems appropriate for the situation. You're dressed appropriately. You seem relaxed. Do you have anything you want to tell me before we get started? All right, so I'm going to ask you a couple questions. Where are we?
Roxbury, Michigan.
Okay. What's the date today?
March 10th, 2021.
All right. Who's the president?
Joe Biden.
And what are we doing here today?
I had to toe assessment.
All right. So those were all correct. You answered the 4 out of 4 questions. This shows that you are oriented to time, place, person, and situation. All right. So we're gonna start off with your head. Is it okay if I touch you?
Mm-hmm.
Okay. So first I'm gonna inspect. I'm inspecting your head is symmetrical. It is aligned appropriately on your body. I'm not noticing anything abnormal. I don't see any lesions or masses. I'm going to touch. Okay, and inspecting the hair, there's no lice, manifestations, no lumps. Is there any pain or tenderness when touching your head?
Nope.
Okay, you do have a bun on your head, so I can't get to that part, but all appears normal. Okay, so that appears normal. Is there anything, like, do you have dandruff?
No.
Okay. So, like I said before, your head is symmetrical. There was no lesions, masses, or anything noted in your hair, on your head. Your skin appears warm, dry, and intact. I'm going to feel your temporal. Okay, and now I'm going to have you open your mouth. All right, and close it. All right, that shows that cranial nerve works, and your temporal was fine. All right, and so now I'm just looking at your face. I notice you have a couple moles. You have one on your right cheek, and on your left cheek, and on your forehead. I'm not noticing any pimples or anything. So now I'm going to go to your eyes. Oh, and your face is the correct color for ethnicity. All right, so now going to your eyes, your eyebrows and eyelashes are distributed evenly, and so is your hair. I don't see any missing spots of hair. Have you close your eyes for me? Okay. They appear normal. Your scapula is white. Your irises are brown. Can I have you pull down on your cheekbone so I can see your conjunctivitis? Or if you have conjunctivitis. Okay. No. All right. Your conjunctiva is pink. I don't see anything abnormal on your eyes. Do you have any vision changes?
Nope.
Do you wear glasses or contacts?
No.
All right. And so now I'm going to use my pen light, if that's okay. And I'm just going to check the accommodation of your eyes. All right, your pupil responded well. Let's check this pupil. Okay, so your pupils are responding well to light. They are equal in size. They're about a size 3. I'm not noticing anything abnormal about your eyes. Do you have any strain on your eyes?
No.
Okay. So now I'm going to go to your ears. I'm just going to inspect them. Okay. I don't notice any discharge or drainage. Do you have any problems with your hearing?
Nope.
No hearing aids?
Nope.
All right. I'm going to check inside them. Okay. No wax. Like barricades. No. Nothing that's stopping your hearing. I don't see any drainage. Your ears look pretty clean, so good job on that.
Thank you.
I notice you have 2 earrings on both ear. You have 3 holes. Can I touch your ears? Okay, is there any pain or tenderness?
Nope.
All right. Now I'm going to do a whisper test. It's where I'll say 3 words and you repeat them back to me, okay?
Today's Wednesday. Tomorrow's Thursday.
All right, that was good. So you passed 3 out of 3. The hearing test. You had a 3 out of 3. So now I'm going to go to your nose since you passed the hearing. All right, I'm noticing that you have 2 piercings in your nose. There's no deviations in your nose. Can I have you look up? There's no deviations. Can I feel your nose? All right. The skin is warm, dry, and intact. Any changes in the smell?
No.
Okay. Can I have you put your head up again? Okay. There is no abnormal findings in there. Like I said, there's no deviations. Just some hair, but that is normal. That's how we filter the dust and everything. Can I feel your sinuses? All right, so I'm gonna feel right here. Here. Is there any pain or tenderness when doing that? Nope. All right. So there's no abnormal findings on the nose. There's no masses, lesions, or discoloration. It appears normal for ethnicity. All right, so now I'm gonna go to your lips. All right, so your lips appear slightly moist. They are pink. Around the mouth is intact. Can I feel? Okay. Is warm, dry, and intact. Like I said, the lips are slightly moist. And can I have you open your mouth? All right, the tongue appears pink. All right, can I have you say ah? All right, the tonsils are about a 1+. Can I use the ah again? All right, the mucosa is pink. The oral mucosa is pink. Can I have you pick up your lips so I can see your gums? Okay, your gums are pink and intact. I don't see any things. Your teeth, it looks like you did have braces, correct? Okay, any other dental work? Okay, I don't see any other dental work. Can I have a look at it one more time? Okay, and then I would put a stick back to test your gag reflex if I had one. To check your soft palate. But everything in your mouth appears normal. The sides are pink. No lesions, masses in there. Do you have any changes in your taste?
Nope.
All right, good. So now that we've done the hair, the head, the eyes, the ears, the nose, the mouth, I think we're safe to go to the neck. All right, so I'm just gonna feel. Well, first I'm gonna inspect. Alright, I don't see any lesions, masses. The color appears normal for ethnicity. Are you having any pain in your neck, tenderness? Alright, and during this assessment I will touch and ask about pain and tenderness too. Okay, so I'm going to touch. Okay. Is there any discomfort?
Nope.
Alright, so I'm going to see that this is midline. I don't see any abnormal things. I'm going to check your lymph nodes, okay?
Mhm.
So the pre-auricular, post-auricular, occipital, your jugular, your submandible, your submental, your superficial, your deep, your posterior. Any discomfort at all?
Nope.
Okay. And then your supraclavicle. Alright, those all appear normal. They're not enlarged at all, so that is a normal finding. And you said there was no pain when touching it? Alright, so your thyroid gland is normal. Your neck appears normal for ethnicity. I noticed a little small mole right here on your neck, but that's not abnormal. Around any pain, discomfort? Okay. And like I said, your trachea is midline. I'm going to check your bruits, which is just like a swishing sound. Alright, there were no bruits, so that is a normal finding. Now we are going to go to chest. Alright, so I'm going to inspect. Okay, the color is normal for ethnicity. There's no lumps, masses. I see your clavicle is right here. You have a tattoo on your left side. But I don't see any abnormal findings, lesions, or masses. Do you have any pain in your chest? No difficulty breathing. Do you have a family history of like respiratory problems?
No.
And do you smoke, or are you in a household that has smoke? That you smell smoke? Okay, good. So, so I inspected. Now I'm going to palpate. Is that okay?
Yep.
Something I forgot to do in the neck is check your carotid artery. Okay, strong, nice and regular. Okay, strong, nice and regular. Alright, sorry about that. Alright, so now I've inspected, palpate. I've already percussed. I percussed those, and I didn't hear any bruits or anything like that. So now I can auscultate. I'm going to auscultate your heart. I'll do your heart first, and then I'll do your lungs. Okay. So aortic, pulmonic, Erb's point. Alright, aortic. I'm going to listen for 1 minute. So that was about 86 beats per minute, normal, regular. So that abrasion work that you had on your heart. All right, and then I'm going to do your tricuspid and your mitral. All right, S1 and S2 were heard in all parts of your hearts, which is S1 is lub and S2 is dub. So that is normal finding. I didn't hear any crack, anything in your heart that would be abnormal. I heard no murmurs, no nothing. Sounded normal. All right, so now I'm gonna listen to your lung sounds anteriorly. So right here first, okay? All right, let me know if you're uncomfortable at all. So that all appeared normal. I heard no wheezing, crackling. I listened to the 8 different spots, and I did map out the lung field before so that I know. But besides that, I heard there was nothing else. So like I stated, no wheezing, crackling. Does your heart have, or your family have any heart issues?
Yeah.
Does history of heart? Okay. And like you said, you had that surgery, so obviously you had something going on with your heart, but all sounds normal. Like I said, I heard 86 beats per minute, which is a little above normal. We like to, but not terrible. We like between 60 and 80. All right. So now I am going to do your arms. Your arms appear normal for ethnicity. The color is appropriate. Is warm, dry, and the skin is intact. Do you have any pain in your arms? Okay, good. I'm gonna feel your hands. They are dry, warm, and intact. A little sticky to the touch, just because it feels like you're sweating a little bit. I'm gonna check your capillary refill. All right, that appears less than 3 seconds, so that is a normal finding. I'm going to check your skin turgor for tenting. All right. And this shows no signs of dehydration because it went down right away, so that is good. Are you drinking fluids regularly? All right, good. All right, so now I need to check your pulses bilaterally. I'm going to check your brachial. Okay, those are normal. And then your radial. All right, those appear normal too. So I have inspected. I don't need to percuss at all. I don't need to I did palpate. Can I feel one more time? Just. All right. I'm going to have you pull on my hands, all right, and then push. All right, this shows that your strength in your arms is appropriate and good. There was no abnormal findings for that. So your arms appear normal. Do you work out at all?
No.
Okay, that's okay. Me either. All right, so now I'm going to go to your stomach. Well, actually, first, before you lay down, I'm going to do your back.
Okay.
Your posterior lungs, if you want to face this way. No, yeah. Okay. All right, so first I'm going to inspect There is no lesions, no abnormal findings. When touching, I don't feel any abnormal findings. The color's correct for ethnicity. Yes, I don't see anything wrong with that. I am going to have you breathe in. Okay, your thoracic expansion is correct. When feeling your lungs, all right, one more time. Breathe out. The expansion is good. I'm going to check for tactile fermentation, so have you say 99.
99, 99.
No, slow.
99.
Hold on. Take a, like 99, and then breathe. Okay.
99. 99.
Okay. The vibrations that I felt were normal. I can feel your spine. There's no signs of scoliosis or anything like that. It appears right down the midline. Do you have any back problems?
No.
All right, your back problems run in your family?
I don't think so.
Okay, good. All right, so now I'm going to listen to your lungs. So the same questions I asked you before. Do you have any family history? Those all go to this of lung. Let me know if you're having any distress when breathing. All right, I mapped out. So I'm going to listen to 10 different lung sounds, or 10 different lung spots. Deep breath in and out. All right, deep breath in and out. 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 Deep breath in. Alright, I'm just going to listen to the side of your lungs too. I just don't know if I did that in the front. So deep breath in. Okay. Alright. Alright, so that all appeared normal. I'm not finding anything abnormal. I'm going to percuss for any sound. Alright, that all sounded hollow and nice. There was no abnormal findings. The lung sounds sounded correct. I'm going to percuss your interior lungs before I to do that. Alright, so like I stated, there was no crackling, wheezing, anything to be concerned about. It sounded very healthy. I can tell that you're a non-smoker, that you're not around smoke. You don't sound congested at all. Do you ever get like that mucus feeling in your throat?
Not often.
Okay. Alright, so now that I've done your anterior, posterior, back, your arms, I am going to do your abdomen. Alright, so I will have you lay down. I'm going to come on the side of you. Is that okay?
Yep.
Okay. I'm going to lift your shirt up a little bit. Is that okay?
Yep.
Alright. So, I'm going to inspect first. Can I have you pull your pants down just a little? So I can see your belly button. Okay. So, there is no abnormal findings, no lesions or masses. It is straight down. There's no distension. And that is one thing I didn't note that there was no distension in her neck. And when you sit back up, I'll have to have you do the up and down thing on your neck. You move your range of motion on your neck. I'm going to auscultate before I palpate and percuss. All right, so I'm going to listen in 4 different quadrants. There was, your bowel movements were active in all 4 quadrants. They appeared less than 10 seconds, so that was a normal finding. I'm going to listen to for any bruits or anything. Listen right here. Listen in 3 spots. Okay. And I listen to your 4th one, your femoral, but that is a little too low for me. I'm noticing that you have your belly button pierced. There's no abnormal findings about your umbilicus. I am going to percuss in all 4 quadrants, because that is normal. Now I am going to palpate, just a light palpation first. Okay. I don't feel any lesions or masses. Now I'm going to deep palpate. Alright, I've done this in all 4 quadrants. I've done this around, and I'm still not feeling any lesions or masses, which is appropriate. I noticed that your ribs are sticking out, but I think it might be because you're laying down awkwardly. But your ribs do stick out. So there was no normal findings in your stomach. So I'll have you sit up, and I'm going to have you do your range of motion in your neck. Alright, so can I have you move your head up, alright, and then down, and then side to side. Alright, good. And like I stated, I see no jugular distension, no, so that's normal. So now I'm gonna have you, I'm gonna actually do your legs. Alright, so I'm gonna have to have you put your legs up so that they can be seen. Alright, thank you. Alright, so saying if I could see your legs, the color appears normal for the ethnicity. I don't see any lesions or masses. Do you have any pain or tenderness in your legs? Alright, good. So now I am going to, so I've inspected, and now I'm going to touch. Is that okay? Mm-hmm. Okay. Not feeling any lesions, masses, none of that. I'm gonna feel in your foot. Okay, no lesions or masses. That's a good finding. Do you have any pain in your feet normally? I know you work, so.
Not anything serious, just a little sore sometimes.
Okay. Any swelling?
Nope.
All right. There's no edema in your legs. I'm gonna check your popliteal pulse and your posterior tibial pulse. Bilaterally, I'm checking, and your popliteal pulse was equal bilaterally. Your posterior tibial and your dorsal tibial, checking these bilaterally. All right, and they are equal bilaterally. I don't know if the camera can see. They're equal bilaterally. So there's no, I stated that. I am going to have you do the push and pull. So I'm gonna have you pull or push or pull and then push. All right, that strength, it shows that you have sensation in your feet. And so another thing that I've noticed that we forgot to do is the dull to sharp. So I'm going to do that in your feet first.
Sharp.
Ooh, you have to close your eyes.
Sharp. Dull. Sharp. Dull.
Okay. And now I'm going to have to do that in your face too. So.
Sharp. Dull. Sharp.
Okay, so that showed that all sensation is good in your face and in your feet. Like I stated, there's no abnormal findings in that. I am going to have you, nope, I need your feet a little off the ground, yeah. All right, and I'm gonna hit to check for, if you have the sensation in your foot, your pedal, yeah. All right, so ready, I'm gonna hit them. The camera see. All right, so I'm gonna hit the back of your heels. All right, there's a little movement in your toes and feet that show that is working. Okay, yep. So that is appropriate. I don't need to check your knees for that. Can you bend your legs correctly? Yep. Good. So your range of motion for your legs is there. Now, I'm gonna have you do some range of motion with your arms. Can I have you bring your adduction and abduction, this is abduction and then adduction. Bring your arms in, and then can I have you move your hands supination, pronation. So supination. Okay, that shows that your wrist and your arms are capable of range of motion. Was there any pain or discomfort when doing any of that?
Nope.
All right. And so now I have done this all on your head, your eyes, your nose, your mouth, your ears, your neck, your chest, your posterior chest, your anterior chest, your abdomen, your legs, your feet, hands. I'm going to check the capillary refill on your toe. Okay. It's less than 3 seconds. There's no edema noted. Your pulse was about a 2+, which is normal. Your tonsils I graded about a 1+. And now I'm going to do a neurological test. Something to make sure. And I'm going to do the cranial test. I'm going to have you follow this pen light. All right, so there's no distension showed there. Your eyes don't seem in distress at all. You haven't seen it in distress at all, respiratory, breathing, anything like that. So now I'm gonna have you touch my finger and bring it to your nose. All right, we'll do that in different locations. All right, one more. All right, so you did this appropriately. It shows that this cranial nerve is intact. Now I am going to have you touch your leg and bring it down your shin. All right, and then the other one. All right, that shows that cranial nerve is intact and working properly. I'm going to do a Romberg's test. I'm going to have you stand up. All right, and then I'm going to have you turn around. All right, I'm going to put my hands on your back, and I'm going to have you put your arms up. Just out to the side. Okay, and then down. All right, you can sit down. This shows that you are, you have good balance. There was no signs of that you had a stroke before or anything like that. You didn't fall back at all. Your stance was good. A lot of people with strokes can't do that. I'm going to give you some education. So for breast examination, you are going to feel probably once a day, maybe when you get out of the shower or before you get in the shower, you're going to feel inside your clothing, your breast, feel for any lumps, masses, anything that might trigger, oh, this isn't correct. And you're going to feel down to your armpit. You're going to look at them, make sure they look normal, like there's no new things growing, like a new mole or something. So you just want to do that about probably once a day, at least once a week, because things like that can come out of nowhere.
Okay.
All right. And so now I'm just going to go over what we've done. We have done hair, and I've inspected your hair. No lesions, masses, lice. Your hair is evenly distributed. I've done your face. We have tested your cranial nerves, done your eyes, your nose, your mouth, your ears, your neck. You've answered all the questions for me. I've done your range of motion on your arms and legs. Your abdomen, the bowel sounds are normal. Your heart appears normal. I listened in all 5 spots. In your lung field, I listened to 8 in the front and then 10 on the back. Those all appeared normal, no wheezing, crackling. You can bend your legs. All of your color appears normal for ethnicity. Your capillary refill is less than 3 seconds. And I really have had no abnormal findings. Is there any questions?
No.
Do you have any other tests that you need to do, or?
I don't think so, no.
All right. So is this all you're here for today?
Yep.
All right. Well, I think this concludes our head-to-toe assessment and your education. If you have no questions, I guess we're done here.
Okay.
All right. Thank you. Have a good day.
You too.